The National Collaborative for Health Equity invites you to listen to part one of a two-part conversation about youth justice, leading the way.
My name is Alma Stewart Allen. I'm the president and founder of the Louisiana Center for Health Equity. We are a nonpartisan, nonprofit, statewide organization in Louisiana based in Baton Rouge, which is the state capital.
Hello, Alma. My name is Angela Waters Austin. I am the founding executive director of One Love Global, which was founded in Detroit and is now based in Lansing, Michigan, which is Michigan's state capital. Our youth work is centered around the Peace and Prosperity Youth Action Movement. It began as a response to gun violence in our community. We collaborated with the Ingham County Health Department to pilot a Health Equity Youth Academy, in addition to another exciting project called The Power of Nine. So it was part education and teaching youth about advocacy, building leadership, and then the other was just really about how we bring community partners together. And we partnered with a radio station and a nightclub, and we created a safe space for teens throughout the summer. But the Peace and Prosperity Youth Action Movement actually grabbed a hold, and the youth who were in middle and high school decided that they wanted to actually form a coalition, and they became our region's first youth-led coalition, and they still 16 or 17 years later are our region's only youth-led coalition. And so there are members from different school districts, from middle to high school, and over the 17 years, one of the earlier cohorts came up with the idea of Peace and Prosperity ambassadors. They were graduating. They wanted to figure out how to continue to be involved. And it actually came to fruition a few years ago with a completely different group of youth. They decided to make it happen, even though they had gone on to college. So we have our ambassadors who now facilitate our Peace and Prosperity Youth Action Movement middle and high schoolers. And they also facilitate our summer youth organizing school, which is called Freedom Summer Youth Organizing School. And we developed that in partnership with the youth during the pandemic. We needed to find a way to be able to continue to serve and to support our youth, even though we couldn't be in a physical space together. So we hired 10 youth and we co-created Freedom Summer Youth Organizing School. And 6 years later, we're planning our 6th season.
Awesome. That is awesome. Thank you for sharing that. Along those lines, we also have some initiatives that focus on peace in our area. So we have a program called the Youth Peace Olympics, which is a youth violence prevention program. And that was the first youth program that we started, which we're now in our 13th year. That evolved into other youth programs such as our LIFE program, which is Louisiana Youth for Excellence, and LEAD, which is a leadership and advocacy program. And we've been very proud of the young people that we've worked with over these years. We're currently rebranding all of our youth programs under the Wade Institute for Youth Equity. The youth in the program told us very clearly that the issue that was most pressing and that cut across all the other issues was mental health. And that was coming off the heels of COVID. So out of that, we have had a significant shift in our policy, mental health policy or behavioral health policy, particularly around trauma and how we respond to our young people, especially in K through 12. So tell me, Angela, what brought you to this work? What brought you into this work?
Actually, during a shift in my personal life when my father was diagnosed with cancer, and I made a choice to be his primary caregiver. And that is what really brought me to Lansing. And I had to really think differently about what my life was going to be like. And I didn't have the same passion for consulting to go back to it. I tried it. It just didn't work. And after 3 days of prayer and fasting, I got a download for what One Love Global was going to be. And we have continued to walk in that mission since then.
Oh, what a phenomenal story and journey. that got you to where you are. I live in a area that I didn't grow up in, especially among our young people. The violence here is very high. We began to implement a public health approach to violence prevention in what is known as the Guardia community. At one point, they had the highest murder rate per capita in the country in that small community. We began using a public health approach, which starts with mobilizing the community and looking at the data, gathering the data, mapping it out. So we worked with the community members who were very interested in obviously reducing the crime in their area, but didn't know what to do, didn't know how to do that other than through the law enforcement avenue. I'm happy to say that it has been very effective, and that community really has transformed. And it's been primarily because of the stakeholders, the homeowners, the businesses, the crime districts that have invested in, their community and that have partnered with us over these years to provide resources and alternatives for young people.
So similar to the way that you uh, entered into your interventions, it was really data driven. One of the most prevalent, I would say maybe correlated, was segregation, like where there was deep separation and where there were fewer resources within the urban areas, and where there were kind of suburbs surrounding those urban centers. There were higher percentages of youth violence, of youth in poverty, and just a lack of opportunity. And it was actually in doing that work that President Obama issued the My Brother's Keeper Challenge. So we continue to convene My Brother's Keeper in Lansing as well as statewide. So, in fact, Michigan was the first statewide My Brother's Keeper in the network. We had a racial equity accountability process that used tools that were then shared with us through the Truth, Racial Healing, and Transformation process. I would say it's a collective. It wasn't just one voice that changed it. And I also want to reiterate that, or clarify that we are My Brothers and Sisters Keeper, because when our mayor took the challenge, he challenged us and said, you can't leave girls out. So we have been My Brother and Sisters Keeper this entire time. And our young women are some of our most powerful leaders. And so Peace and Prosperity Youth Action Movement, like I said, it started as a summer pilot. Let's see where it goes. They decided they wanted to continue. And we were receiving some funding, and they were receiving their stipends, and the funding ended. And I had to have a really challenging conversation with the youth about whether or not they wanted to continue if we didn't have the funds to provide stipends, and if we couldn't provide food every time or transportation, things that we had really depended on to have a strong program. And because they had been trained in community organizing and advocacy, they asked me to leave the room. And I did, and they had a conversation. They decided if they wanted to move forward and what it would look like for them to continue to do so. They invited me back in the room, and they had up on the board they had done some brainstorming and some strategizing, and they said, okay, this is what it's going to take for us to move forward. We get 85% of the power, and you get 15% of the power. Your 15% is you find us the resources, you find us the spaces that we need, and you get us in front of the people that can move policy and actually respond to our agenda. And here we are. That was well over a decade ago. And they are a powerful group of youth, and how they came together and realized that they had so much more power as a collective voice rather than one voice.
Okay. So I as I reflect on that question, there are two things that really stand out for me. One is early on when we started our youth violence prevention program, one of the youth, and it was a family that had three young boys who were in our age range to participate in the program. But they did not want to participate in the program. They did not want to register for the program. So we spoke with them. Some of our guys talked with them, and, you know, they agreed to participate. Once they were in the program, we had the opportunity to ask them why they were hesitant about participating, about joining the program. And what they said to us was that the programs are nice, but they still have to go back home, and the conditions at home and in their community are still the same. And that really stood out for me because what that helped me to understand is just um, how much the environment that our children are growing up in affects them and influences their lives, really. Another example is when we had uh, one participant who was 12 years old, but he was really large for his age. He was 12, but he looked like he was at least 18 or more older. And so people really thought that he was older than his age. And he really had some issues with or problems with sitting still and some attention deficit, I would say. And so it was hard for him to just sit and participate, sometimes in some of the sessions. So we would, have to make some accommodations for him. But um, we we learned that by communicating with the family, with the mother and the grandmother in that case, because the grandmother actually was the one who had signed the children up, and it was three of them of her grandchildren that she had signed up for the program that summer. And so when we contacted the parents and we set up the meeting with the parents, the first thing that they said was, well, if they're a problem and they're getting into trouble, if he's getting into trouble, we'll just take him out of the program. And we said, no, that's not what we want. We want him in the program. We want to work with you so that we can help him to get these behaviors under control. So then they relaxed and we were able to talk about what was going on, what kind of behavior he was exhibiting, and develop a plan with him and the family that we all could, agree upon for him to manage those behaviors. Because our position was, if he's having these behaviors, exhibiting these behaviors here, he's probably exhibiting the same behaviors in school, which is going to cause him to get kicked out of school. They're not going to, take the time and effort, at least generally here, what happens when a behavior rises within the school or the classroom, they basically suspend them, send them home. And so we're saying we want him to stay in the program, and we want to help him manage these behavioral challenges that he's facing, so that he can stay in the program, and also that they won't we can get them under control when he goes back to school in the fall. And so that was another great example, I think, of, community and how community can come together. And we, explain to them that we are a part of your community and your village, and we want to support you, the family. And I think that's something that's oftentimes missing in our communities, especially communities of color and low income communities, when they are, challenged or struggling for various reasons. Maybe it's behavioral or whatever, but that behavior has a cause. Our children are exhibiting those behaviors because of something else that's going on. And if we can, address the cause and help them develop a plan and implement a plan to help them succeed, which is our goal with our youth violence prevention program in particular, is to help our young people to succeed and to become productive, thriving adults. And so that I really, appreciated that intervention, that situation as well, because it was truly um, a family approach. We had not only the mom, but the grandmom as well in, sitting together and, defining what was happening, not just what we were seeing in the program, in the summer program, but also what was happening at home and in school, and to develop a plan of action, a behavior intervention plan, basically for him, because he's old enough to learn to manage and get those behaviors under control. They will determine what's going to happen in his future. If he did not, they would have determined that he would have continued to get into trouble, not just in the program, but in school, getting kicked out. And we didn't want to see that. So we were able to successfully work with that young man and his family, and to help them to get those behaviors under control. So that's just an example of how we have been able to work with young people, and a story about a success. I believe that, you know, even though we look at our programs as a whole in terms of the numbers, and we want to have large numbers, we want to reach, a lot of people, a lot of young people, it really starts with one by one, in the ways that we touch their lives. And I believe we've touched a lot of lives over these last 12, 13 years of being in the community and working with our young people.
To learn more, look for Part 2 on our website, nationalcollaborative.org/hope in action.